we're going to do a demonstration of how to do the prescriptions. This is exciting because this will showcase how you can use zDoc to actually get your doctor to provide you a prescription. We've also added a feature. As we go on, you'll see either the doctor can pick between their internal pharmacies, so hospitals that have their own pharmacy, or by default we'll go to an external pharmacy, external pharmacies that don't have a hospital, so like CPL, ChemCare, any others. So we want the patient to be able to know that they can get a prescription without having to go into the hospital. The motive behind zDoc PNG is to minimize the number of times you go to the hospital. So let's get started. So now that the doctor connects with the patient, this is also going forward from when we created the doctor and the patient. Doctor will go straight and click on prescription. Now in the prescription, like the usual process in a hospital, you go in, doctor writes on a piece of paper, medication is required, signs off on it, and gives you a piece of paper. Only go to the pharmacy and pay over the counter. Eventually what we'll do is we'll integrate pharmacy's inventory to allow us to invoice and be able to pay for the medication on the platform. But for now, it will generate a PDF copy or electronic copy of a prescription that will get sent to the external pharmacy. It will engage into zDoc, or it will send a copy of that prescription to the internal pharmacy, and the admins can define that email address for the pharmacy in their dashboard. So the doctor can go ahead and say 1 times Panadol. I'm not a doctor, so don't expect me to put all the fancy names into this. And you'll see at the bottom here, the external pharmacy or internal pharmacy. So I'll keep that there and click send. And again, you'll get a ribbon that will tell the doctor as well as the patient when there's been a prescription sent. Yes. Now let me just show this on the phone. There you go. You have your reference numbers, your dates, patient's name, doctor's name, your prescription, and a link to the PDF. And there you have it. So again, the branding, the colors are more important so the patient know what doctor or hospital has prescribed them this prescription. This is also beneficial for the pharmacy, and the same details that was put in there are shown in the PDF file. There you have it. Simple and easy to be able to retrieve a prescription, talk to your doctor, immediately get a prescription, head down to your external pharmacy, or otherwise head down to the hospital, approach the internal pharmacy, pay over the counter. Again, we will integrate a payment system once we get a hold of the inventories from the pharmacies to be able to invoice the exact amount so you can pay on the platform.